Do you often isolate yourself and feel depressed? Do you find yourself talking excessively with racing thoughts and little to no sleep at night? Are you usually overly excited with an abundance of energy for a long period of time?
Then you need olanzapine, or known as Zyprexa. Zyprexa is an antipsychotic medication that blocks dopamine receptors in the brain, correcting the overactivity of dopamine. Now, what is dopamine? Dopamine is a neurotransmitter that acts on the brain to give you feelings of pleasure, satisfaction, and motivation. With high levels of dopamine, it can cause a spectrum of disorders that affect mood and behavior. These disorders can include schizophrenia, bipolar disorders, or behavioral disorders. With Zyprexa, it can balance the levels of dopamine in your brain and manage the symptoms of mental health conditions. Adverse reactions of Zyprexa may include
Dizziness, insomnia, auditory hallucinations, tachycardia, chest pain, sore throat, constipation, dry mouth, thirst, weight gain, weakness, and dyspnea.
Zyprexa can also cause a rapid increase in your blood glucose levels. That is why you should expect a routine lab work throughout your treatment to monitor those blood sugars. Some complications that can occur when taking Zyprexa is tardive dyskinesia and extrapyramidal syndrome. These effects can be fatal if not corrected. Immediately discontinue the drug use and contact your healthcare provider if you notice these involuntary movements. Body and face, or both.
Yes, that's right. Zyprexa is a brand name and olanzapine is a generic name. Not only Zyprexa interacts with other drugs, but also it can interact with other substances such as alcohol, which increases the nervous system side effects, such as drowsiness, dizziness. Zyprexa can also interact with grapefruit and grape juice. Therefore, you need to avoid because it can prevent the breakdown of olanzapine in your body, therefore increasing the amount of olanzapine in your blood. And while taking olanzapine, remember that it can cause urinary retention. Therefore, you need to empty your bladder before you take olanzapine. It can also increase the body temperature. Therefore, you need to keep monitoring your temperature every time you're taking this medication. It can also cause orthostatic hypotension. This is when the temperature goes down as you're trying to stand up from a sitting position. To avoid negative outcomes of taking Zyprexa, take the prescribed Zyprexa at the same time each day. Take this medication even if you feel better. Do not stop it. Do not stop Zyprexa until your doctor tells you to do so. Yes, Zyprexa is antipsychotic drug. Can be taken orally or intramuscularly. It can treat schizophrenia and bipolar disorder. Take Zyprexa, the only solution.